Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Steve Sell and Dr. Andy Mueller. They're joining us here. Steve is CEO of Agilon Health, the trusted partner empowering physicians to transform community health. And Dr. Mueller is joining us here as CEO of MaineHealth, the largest integrated health system in northern New England. They're going to talk with us about their recent partnership and how this partnership aims to impact the continued evolution of the U.S. healthcare system. Welcome to Health Professional Radio, both Steve and Andy. How are you both?
Doing great and happy to be here, Neil. Likewise.
Steve, if you would give us a brief look into your professional background and talk a bit about Agilon Health's role, and then Dr. Mueller, if you would do the same after Steve concludes.
Sure. Steve Sell, I'm the CEO of Agilon Health, and I've spent my career in healthcare services. And really excited about what we're doing at Agilon. Our vision is really to transform healthcare at the community level. And we believe that the primary care physician is really the key to making that happen as the care quarterback. We have a unique strategy and platform. What we focus on is building exclusive long-term partnerships with organizations who've been in their communities for decades and are incredibly well respected. And we focus on senior patients and moving those patients, physicians, and payers from a world of fee-for-service payments into a value-based care world in which the focus is on the total cost and care for that patient.
And Doctor.
Yeah, hey, I'm Andy. I'm the Chief Executive Officer of MaineHealth. I'm a family physician and former Air Force flight surgeon, and find myself now leading what is the largest integrated healthcare delivery system in northern New England. We're a not-for-profit healthcare system that consists of 9 individual hospital systems, a behavioral health network, laboratory agency, home health services company. And together, we've got approximately 1,700 physicians and advanced practice providers in our MaineHealth medical group. And then we partner with several hundred other private practice physicians on our medical staff. We've got about 22,000 employees, and we provide all of those services to approximately 1.1 million individuals in Maine and New Hampshire.
This recent partnership between both of your healthcare companies, what prompted it? And why is it significant, as I said, as it relates to the evolution, the continued evolution of our current healthcare system here in the United States toward primary care-led, value-based care?
Yeah, from my perspective, this is really a bellwether partnership for Agilon, for MaineHealth, and frankly for the country. We've been able to work with partners in 17 markets and 8 states to date. Those are primary care only and multi-specialty groups. But MaineHealth is the first integrated health system that we're working with. It's the first statewide organization because of the expanse that Andy just talked about. And it's the largest group of physicians that we've brought on the platform. And so I think it's just a real signal for the region and for the country when a health system is interested in a partnership like this. And making the move to value-based care.
Andy, when MaineHealth was presented with this opportunity, what did you find attractive about Agilon Health?
Well, Neil, I think it's important to understand that at MaineHealth, we are deeply, passionately committed to achieving our vision of working together so our communities are the healthiest in America. And I think as you and probably many of your listeners know, our current business model in healthcare is really not aligned with that vision. And so we recognize we have to change it. And that's really what got us excited about partnering with Steve and Agilon. We saw that Agilon starts to enable us moving toward really focusing on creating value for our senior patients who have Medicare Advantage, focusing equally on keeping them healthy and out of the hospital, as opposed to just focusing on what we do when they get sick and have to care for them in one of our facilities. And so we saw this as a significant, large step in the direction of changing our business model to better align with that vision statement of working together to our communities and healthiest in America.
Have either of you experienced any, pushback from those who would rather deal with the status quo, both from the caregiver side, the physician side, and possibly the patient side as well, with this new shift that's coming?
Yeah, I'll start by saying that at MaineHealth, we had to really help key stakeholders understand the value that we thought this would create for our patients. Fundamentally, we create that value by doing things that we know are going to help improve healthcare outcomes. So making sure that gaps in care are closed, the patients have connected with their primary care team over the course of the year, and that we're doing things to fundamentally help provide better care for the patients, reducing admissions and doing similar things. So once we really began to explain that to our board, to our physicians, to other key stakeholders, we started to garner some enthusiasm. And I think our team did a really great job of ultimately presenting this to our physicians. And Agilon did a great job with Agilon physicians connecting with our physicians around what the experience has been like and really helping our physicians understand how they really meaningfully improved the condition of their patients in a way that, frankly, at the end of the day, got our physicians on board with doing this, which was important because I think we understood that if our physicians weren't enthusiastic about this, then it really wasn't a partnership worth pursuing. But ultimately, when they really began to understand what this would afford us, they got very excited about it.
We've been doing this for 5.5 years now, and in the early days, it took longer, and there were skeptics. But now we're in 8 states and 17 communities. We're approaching 500,000 seniors. For Andy, for his team, for anyone who's thinking about this, there is a group or an organization that probably looks and sounds like them that they can go and talk to about that experience. And the problems that everyone is addressing here is the challenge with primary care. It's the key to improving health in these communities, but it's underfunded. Primary care physicians don't have the time, the information, and the resources that they need to really play that role. And so with the benefit of that sort of experience and credibility, more and more organizations are looking towards this. The government is looking for the move from fee-for-service into this world of value-based care. Payers are looking for it. Patients are getting it. And, just one anecdote is in the middle of COVID, as crazy as it was, our net promoter scores, which speak to the satisfaction from our patients, went up pretty dramatically, and they're world-class levels. I mean, they're better than Apple and Southwest Airlines. And what the patients said is they felt cared for. They felt like they had that trusted relationship. They felt like their primary care physician had teams around them. They were able to interact with them no matter what that circumstance was. And so I think we're doing a fantastic thing, and there's just a lot of momentum around it. But this partnership with Andy and MaineHealth is really a big step forward.
What do either of you see as far as the future, this primary care mindset, caring for the patient, making the patient feel cared for, demonstrating that? Do you see it trickling down into the mind of the specialist? Yeah,
I think, Neil, you're hitting on a big point, is that I think ultimately at the end of the day, the reason we need not-for-profit healthcare is to promote and enhance trusting relationships between patients and their care team and providers. And so I think that has to happen at every level. I think that's sort of been the fundamental principle behind primary care for its existence. And I think that many patients find that same level of relationship and trust with their specialty physicians. And clearly that's something we want to grow and enhance. And I think that that's one of the things that excites us about this partnership is that Agilon has been able to help physicians really enhance those relationships between their patients and their care team. And so we think that we're going to learn a lot through this partnership that will enable us to help really create a better experience for our patients across the entire care continuum.
Where can our listeners go and get some more information about both of your companies?
At MaineHealth, you can find us at www.mainehealth.org.
And for Agilon Health, it's www.agilonhealth.com.
Well, I appreciate both of you joining us here on Health Professional Radio. Steve Sell and Andy Mueller, thank you both for your time. And I'm looking forward to speaking with both of you again in the future. Thank you.
Sounds great.
Thanks, Neil. Appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Steve Sell and Dr. Andy Mueller. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.